Shall we start, sir?
You can start.
Yes, Miss Pariyar, please continue.
Good morning, everyone. VETICOS Advanced Learning is presenting to you webinar on veterinary surgery and radiology, one of the webinars of Career Advancement Counseling series. One quotation: our greatest weakness lies in giving up. The most certain way to succeed is always to try just one more time. Our today's speaker is Professor Dr. Samit Kumar Nandi, who has done BVSc, MVSc, PhD, and he is a fellow of Royal Society of Chemistry UK and Royal Society of Medicine UK. He has received several awards like Jawaharlal Nehru Award for Outstanding PG, National Bioscience Award 2008, Biotech Product and Process Development and Commercialization Award 2013, CSIR Technology Award 2010, Government of India, National Teaching Excellence Award 2016. In 2023, he joined as ICAR National Professor. He is a prolific writer and has contributed to many scientific papers and international journals and many books. Now I request sir to continue the webinar.
Hello. Hello.
Yes, sir.
Yes sir.
So, any slide is showing now?
Yes sir.
Huh?
Yes sir. Slides are visible.
Slide is showing now?
Yes sir.
Okay. So, good morning, everybody. Today's webinar on this career advancement counseling, veterinary surgery, and radiology. So, in career advancement in veterinary surgery and radiology, if you just see the career advancement in specialized subject plays a vital role in professional growth and personal fulfillment. As a veterinarian, it is essential to continuously strive for success and explore opportunities to advance in a specialized field. However, the navigating the path to career advancement can be challenging without the right strategies and tips. Veterinary surgery is a diversified field in India and also other continents, including surgical skills of different species of different organs from soft tissue to hard tissue, along with different diagnostic imaging of different organs. And if you just see in 20 to 30 years back, there was a boom in engineering field, medical field, and the dental field. And nowadays, if you just come back to this present situation, engineering field is to some extent collapsed because so many private colleges are there, job opportunities are very less. Still, if there is any job opportunities, the salary structure is very less, except few places where from these IITs or the some good international engineering institutes, 5 to 10% people will get a good job. But in average, if you just see the engineering field is to some extent collapsed, and the majority of the cases, job opportunities is less. And if there is job opportunities, still the salary structure is very less. And nowadays also, if you just see the that is dental science or dental medical science, that is also less intake capacity at this moment. Still, medical field is okay. So, in these cases, you have to select the certain areas where there is a job opportunities and the possibilities for your in future career. And if you just see more than 20, that is 20 to 30 years back, you just see in every colleges, in every states, there is one veterinary college. And now, except few states, there are more than one veterinary college. Suppose in the Maharashtra it is 45 or 6 veterinary college. Rajasthan is a huge number of veterinary college, including this private veterinary college. And apart from these three, perhaps three government colleges. So, some tips and strategies to enhance the field of veterinary surgery and radiology. So, develop a specialization to stand out. So, everything depends on your specializations and skills. The time comes the need for specialization in individual species and individual organs in relation to surgical skills and imaging. If you just see 20 to 30 years back, when I was a student, and nearly 34 or 35 years back, and there is no such specialization in surgery. So only there is a routine operations in cattle, buffaloes, and the pet animals. But and the imaging facilities what is only this X-ray in some places, and majority of these cases you have to diagnose the problems from your experience. But if you just see this present scenario, there are so many multimodal imaging facilities are available like ultrasonography, color Doppler, CT scan in few states, MRI, and also on the surgery aspect, this laser surgery, echo-emulsification surgery, laparoscopic surgery, nuclear imaging are come up. And with this demand and with these new imaging techniques, this specialization of a particular subject like veterinary surgery and radiology is a must. So specializing allows you to deepen your knowledge, define your skills, and attract unique career opportunities. And if you just see in the medical profession also, nobody and majority of these people, except in village areas, they will not go to these MBBS persons. The majority of these middle class and the high income families, they will just prefer to go for a specialized persons. So specialization is a skill, and that skill in the veterinary subjects can be developed through your continuous effort, dedication, and this you have to that is increase your knowledge. So expand your knowledge and skills through continuing education. So if you just think, just only go through this book, you will develop your knowledge or skills. That is not always possible. So you have to go through these different journals. You have to stay updated with the latest advancements, research techniques. You can enhance your expertise, deliver exceptional care to your patients, attend workshops, conference, seminars related to your field of interest to expand your knowledge base. And if you just see also in 30 or 40 years back, and nowadays also too, if you just see the field level, the old veterinarians, they are accustomed to these chemotherapies, particularly this camantation only with dentistry. So nowadays, if you just see, there are so many chemotherapeutic agents, and their delivery techniques has been observed, and you have to advance your knowledge. Now, so many that is, if you just see also, the previously 30 or 40 years back, in surgery specialization, only for this fracture fixation, we use this intermediary pin. And nowadays, if you just see this with this that is the time passage of this time. There is the development of this bone plating, interlocking nailing, and are also going on. And moreover, the several conferences this from the surgery, that is the ISBS, that is Indian Society for Veterinary Surgeries, are happening per year in the different parts of this country, and where from a person or from a man of surgery can develop his skills and expertise where the newer areas of research or newer area of these clinical works are going on. So for this, the first and foremost things that is necessary to get a good mentor. So just like in a family, just like your father is the first mentor and your mother, that is the parents is the first mentor. Similarly, in the educational line, a mentorship and a professional guidance is a must. Without this proper mentor or professional guidance, a person cannot develop properly to develop his personal skills and experience. So, in a career advancement journey, a mentorship and professional guidance is a valuable asset. For that, you have to find experienced veterinarians who can guide you, offer advice, and share their wisdom. Suppose some person, maybe he is not specialized in surgery, but he is working in this field for a 20 years or 30 years. So he can also learn a lot from him because he has the practical experience. Otherwise, it is not possible to develop your skill from this bookish knowledge, but the person who is having an that is the practicing knowledge for a certain period of time, and from him or her, you can develop your wisdom and develop your skill also. A mentor can provide valuable insights, help you to navigate the challenges, and open doors to new opportunities. And apart from this, developing your skills, they can also suggest you the lines where your career advancement can be flourished and you can proceed so that in a, after passing through this veterinary surgery in masters or this PhD level, you can get a good opportunities for your future thrivers. So for this, apart from this mentor, you have to build a strong professional network throughout the globe. If you just see, just like the arrows, the different countries in different areas, the new research is going on and the techniques. And nowadays, you can learn so many lots of videos in surgeries of different operation techniques through YouTube or different groups, YouTube and also different good groups from this USA or the European countries or the Australian surgeons, Australian veterinary surgeons. So you have to build a strong network and keep your success in the veterinary industry. Stay up to date with the latest technological advancement and embrace tools that can streamline your practice and enhance patient care. Nowadays, if you just see this patient care, particularly for this canine or the pet animals, majority of these peoples, they come to your chamber or these areas or these hospitals with getting some knowledge beforehand from this internet or the Google. And if you are not that is a super specialty person, and if you have not the skills, and if you are not confident, you cannot give any reply to his queries. You just see the 20 or 30 years back, we cannot imagine this type of different modalities in veterinary surgery. The first one, if you just see, there is a laparoscopy surgery. It is the latest advancement that was started in this Chennai Veterinary College, and nowadays many parts of this country in different hospitals and these government uh, colleges and the universities they are going on. And this is the second one is this that is a surgery is done with this inhalation anesthesia. And here you just see the third one, the the fluoroscopy machines that are mainly used for this human care, that is also nowadays used for this animal care. And apart from this, that is the hip joint prosthesis, particularly this canine femoral hip arthroplasty, they are going on. And apart from this, there are MRI and CT imaging techniques are also going on. These are the latest tools and latest developments in veterinary surgery, and you have to learn and you have to develop your skills through all these techniques. Otherwise, to develop your own setup or any government veterinary colleges, you cannot succeed in life in coming days. So for getting some knowledges, apart from your practicing knowledge, so you have to make your updated with consultation with different journals, book, research books, that is veterinary surgery, veterinary radiology and ultrasound, that is VCOT, that is veterinary comparative orthopedic stomatology, veterinary anesthesia and analgesia. So you have to gather, and apart from this, there are certain literatures or these books or the journals are published from these North American veterinary clinics. So you have to develop your knowledge and knowledge through getting some interesting events or interesting research findings or these clinical findings from the different journals and also different books and the conference proceedings. The scope of veterinary surgery and radiology after postgraduate and doctorate. So suppose a majority of these students they will go through this, and that is this undergraduate courses like BVSc and AIS, Bachelor of Veterinary Science and 11 where from there is a multivarious subjects in the nearly 17 subjects they have to cover. The most of the students have to cover. So when after passing through these internships, so there will be some collapsing of this knowledge that is either from this anatomy to surgery or the parasitology or this biochemistry or this microbiology. So from this BVSc, you have to choose. You can choose. A person can choose a different subjects like parasitology or this biochemistry or this anatomy for masters. But I think from this clinical point and from these job opportunities, the veterinary surgery and the radiology is a very good subject after BBSc and age. So these LBSc and PhD scholars as specialists may have the option to start their own private clinics or may be associated with different private network polyclinics, NGOs and specialized surgery. Suppose you are a master's in veterinary surgery radiology or PhD in veterinary surgery radiology. So the scope, yeah, you can start your own clinics. In Calcutta city, in my city, what I have noticed that there are so many master students from our department. They have started their own clinics, and they are per month. Someone is incoming more than 1.5 lakhs, and someone also is having more than that. So they have the skills, they have developed their skills to the different operation techniques, the latest techniques of these operations and these imagings, and they have already developed their in their own clinics. And apart from that, and if you just see in different parts of this country, there are several private clinics has been originated. These students from our departments, they are actually basically from the Bangalore-based students. After passing from masters, they have joined in various private clinics in Bangalore. And so far I know, they are getting more than 80,000 per month. They are giving this salary. And last month, one of my students from this Hyderabad, he joined initially in Hyderabad in one in NGOs. Later on, he has shifted to Pune, where he is getting a salary of 80,000 per month in a private clinics. Similarly, there are so many NGOs in the different parts of this country, and where also these specialist surgery persons can be associated because in most of the NGOs, there is a program that is animal birth control program is going on, but the need for a specialized veterinary surgeon and radiology is a must. Otherwise, they will be trouble for performing their job. So there is three things, three facets. One is the opening of your own private clinics, and or maybe associated with as a private job to these polyclinics on these NGOs as a specialist surgeon can be happens for after passing through masters or this PhD from the surgery and radiology. So these are just you see the different techniques you have to learn. That is this bone plating or something. And here you just see there is a laparoscopy and there is a imaging modalities, there is a eye surgery, there is a phacoemulsified surgery, and I heard that there is one lady veterinarian who is capable of doing this cataract surgery in Pune-based hospital, and if you just see the income of that hospital is enormous because the phacoemulsification of this cataract surgery in a pet animal, that is a virgin fee in few places, in our place, Madam Dr. Hajra, and in Chennai, Dr. Ramli, and one or two surgeons in these different colleges they are doing. That is a virgin field in this, that is this ophthalmic surgery. So there is a specialization, just like a human. The specialization in different parts of this surgery is coming up, like ophthalmic surgery, orthopedic surgery, soft tissue surgery, imaging. So all this happening in a multifaceted in nature, but there is a opportunities for these jobs from the specialized person for this MBC or this PhD is also going on. So MBSc PhD scholars after recruitment as a state veterinary officers, you have the options to work as a specialist surgeon in various polyclinics. So in every state, if you just see through Public Service Commission, there is a engagement or there is a service to the state as a state veterinary officer or state veterinary surgeon. So where in West Bengal, whatever I find that in every district there is a polyclinic, but the three persons, one from this that is the surgery, one from the specialized person from this medicine, and one from this gynecology is being posted. So this there is these opportunities as a state veterinary officers and also as a specialized business surgeon in polyclinics. That is also another option for this specialized as a career advancement program. So the MBSc PhD scholars may pursue in North American veterinary licensing examinations and educational commissions for foreign veterinary programs. So if you just see, if you some veterinarians after MBSc or PhD, they can go to abroad. And from Punjab, I noticed that several surgeons they'll go to Canada. Similarly, the other parts of these European countries, they can go for as a practicing vets. So for that, you have to upgrade your knowledge, and you have to go for this. That is some examinations you have to pass. So apart from that one, other opportunities as a career advancement after veterinary surgery as a research PhD scholars, as specialist surgeons, they have the chance to be recruited as renowned veterinary corps, border security force, Indo TBT and ITBT, Indo TBT and border police, special service bureau, race course, and the railways hospitals. So in every sphere, there is the need of these veterinary surgeons. And if there is a specialization in veterinary surgery and radiology, the chances of opportunity is more as compared to the other subjects because whatever I notice in our Calcutta University Hospital, sometimes on some cases, sometimes on majority of these cases, these BSFs either located in a far away from the delivery or the different parts of the state, including this petroleum also. For the surgery patients, they are generally come to our place for their operations or the surgical advice. And many a times I ask them whether there is a surgeon. They always told that there is having sometimes there is having one veterinarian, but he is not capable of doing this surgery. So you have that specialization. You will get a more opportunities during this interview, or you have the option because these BSF or the authorities, or the ITBT authorities, or the RBT authorities, they are facing these problems. Many times their seniors come here that they told that we have no specialized surgeon, specialized surgery person, so we have to come from a long distance. Many a times we notice that from this Tripura state, by flight they are taking their dogs to our university and hospitals at Kolkata. So, as a surgeon or specialist in MBSc and PhD surgery, this is a good option for to be recruited as a veterinarian in RBC, BSF, ITBT, SSB, discourse. or railway or other areas. So apart from this, you just see in the foreign countries, also in our country also, there are different start farms. Say horse farm, that is a start farm breeding farms, start breeding farms, and where the most of these horses, more than crores, where the veterinary surgery persons have been recruited. In Chennai, I have visited one that is a start farm, that is state start farm, where so many horses are kept and for their men, particularly for maintaining these, sometimes they will face the problems of colleagues, or sometimes there is a need for this cesarean operations. So where there is the role of this veterinary surgery is a enormous. And apart from that areas also in a good cattle breeding farms or also in the forest areas, particularly we just see in these different forests, they are also recruiting some veterinarians, and if they will get the surgery person, their preference will be more as compared to the other specialization of these veterinary sciences. So this is there are the opportunities to be recruited, different start farms, good cattle farms, forestry, and national and state zoos also. So after specializing in veterinary surgery and radiology, if a person is having this capacity for a business minded, they may open startup companies for manufacturing various surgical and medical devices. And nowadays, if you just already told that 20 to 30 years back, for the fracture fixation only bone feeding is used. Nowadays, if you just see the different types of bone plates, interlocking nails, and the different imaging modalities, and these other surgical equipments like short wave diathermy, physiotherapy unit, dental surgery unit, and if you have a business minded, and if you have this knowledge in the surgery and radiology, you can start your own startup companies for manufacturing of various surgical or medical devices, and you can sell it to this Indian market. Also, if it is any affordable cost or the lower cost in nature, then you can export it to these foreign countries also. So another areas there is opportunities as a career advancements from this veterinary surgery and radiology background, that MVSc and PhD scholars may also have the opportunity to be recruited in charge of laboratory and large animal houses in different government research institutes like NIPAR, National Institute of Animal Biotechnology of DBT, Sri Chitra Tirunal Institute of Medical Sciences and Technology, formerly that is Sri Chitra Tirunal Medical Center under DST, and various CSIR research institutes like Indian Institute of Clinical Biology, CDRI, that is Central Drug Research Institute. You will just see in majority of these cases where there is a biomedical research, there is a lab animal house is there. And as you know, lab animal house, as per the CCACA guidelines, that is the ethical committee guidelines, there should be at least one veterinarian who will conduct and who will look after these laboratory animals and also the large animal facilities. And majority of these cases, the biomedical research that are going on the areas of these biomedical implants, both in these orthopedics, cartilage grafting, or the soft tissue surgeries. And where there is this specialization, specialized persons from a surgery, veterinary surgery, and radiology background is a must, and they will get these better chances as compared to the other, that is veterinary gastroenterologists or pathologists on this that is animal genetics and breeding persons. So to conduct a good uh, way of biomedical research in several central institutes and also these different research institutes throughout this country, the need for these MBSc and PhD scholars is also another option. So apart from this, if you just see DST and the DVDs, CSIR, ICMS, there is the options for recruitment of scientists in their headquarters. So headquarters, mostly that job is basically the official jobs, but they prefer these veterinarians sometimes because the research area is a multivariate. The veterinarians have a multivarious that is research avenues and multivarious they have the knowledge and skills. So they are also as a scientist they can also join. So these are these areas where there is a opportunities as a research scientist or a lab animal research house, both at these laboratory animals or these large animal species. So another options from this veterinary surgery and radiology as a career advancement. The MVSc PhD scholar may also have the opportunities to be recruited as scientist in ICAR. If you just see in ICAR, majority of the scientists from the surgery background they are posted in Indian Veterinary Research Institute nowadays because that is the main centers where there is this surgery persons are there. Who can say that in future other centers will be developed because initially there is these centers for this veterinary surgery and background from this ICAR, there is in IVRI, and nowadays there are several regional stations are also built. So one of these principal scientists he has shifted from that areas to these Pune areas in a ICR that is a clinical labs where he is also conducting several clinical trainings also. So who can say in coming days the research in the research capabilities in veterinary surgery and radiology will be opened in new other institutes in other parts of this country from this ICR. So apart from this ICR, there is a Central Agriculture University at Aizawl, in Aizawl, and where there is a recruitment of various assistant professors or the research scientists in that area. And also ICMR, DST, DBT, CSR Institute also they are taking these scientists from this veterinary surgery and radiology background. So after PhD or this masters, the scholar may have the chance for recruitment as assistant professor in veterinary surgery and radiology at different government veterinary colleges of India, including private veterinary colleges regulated by BCS. So if you just see in the initial stages, in every state there was one veterinary college. Nowadays, in majority of the states, not all, they are having 4 to 5 veterinary colleges, like Tamil Nadu. They are having more than 5 or 6, Maharashtra, Haryana also, UP also. So in every opening of every veterinary college, as per these BCI guidelines, there are necessity of these 4 assistant professors and 2 associate professors and professors. So at least after passing from MVSc or this PhD, they can be absorbed in this as an assistant professor level in government veterinary colleges throughout across this country. And apart from this government veterinary college, there are so many private veterinary colleges. They are regulated by this BCI. If you just see, it is Rajasthan that is the first state from where the several private veterinary colleges has opened up, like Apollo Veterinary College at that is in Jaipur, Aravali Veterinary College at Sikor, and this veterinary college at Jammu, and there are so far I heard that more than 7 or 8 veterinary, private veterinary colleges are there in Rajasthan, and in West Bengal, one veterinary college, private college will be initiating will be starting in coming days. In Orissa, there are 2 veterinary colleges have opened up. One is from the Centurion University and one from this Six Arusamma. And similarly, in the other parts of this country, there are so many private veterinary colleges are coming, and where there is a necessity as a assistant professor in a teaching profession who can prepare or who can have a desire for to go in the teaching profession, they can also join, and there is the opportunities as a career advancement in private veterinary colleges also. So if you just see these few months back in paper in newspaper there was a big cutting was happened that there will be a proposed All India Institute of Veterinary Science to be set up in New Delhi. There was a proposal from this Veterinary Council of India, and Government of India accepted these proposals principally, and the other formalities, how and where it will be situated in Delhi, that is that will be streamlined. So that AIFS, if it is developed initially at Delhi, and it is expected just like AIMS in different parts of this country, it will also be established in different parts of this country. The proposal was AIPS in New Delhi was to 200 to 5-seater ultra modern super specialty hospitals with OPD, inpatient medical facilities of these animals will be there, and there will be dedicated departments of surgery, ophthalmology, orthopedics, anesthesia, soft tissue culture, neurosurgery, oncology, cardiology, with state-of-art facilities to treat exotic and indigenous animals. And if you just see carefully in this veterinary surgery and radiology portion, that is the surgery, ophthalmology, all are the branches or the parts of sub-units of the surgery, where this if this if you have this specialization in surgery and ophthalmology, in coming days you will be observed as a scientist or the assistant professor in that area also. So there is the good opportunities in proposed AI case coming up in coming days in our country. So after PhD also, after completion of PhD in veterinary surgery, he may pursue postdoctoral studies abroad, but there may be a chance for absorptions in foreign research labs, or may have the opportunity to be recruited as a scientist in Indian research institute after returning. From here also, I have seen just 1 month back some that is a advertisement coming up, and they ask our universities to send some PhD scholars to send in USA to collaborative work and specialization in surgery. That is, so if you just go through these collaborations to different countries, and if you do a very good job or a better job, you can also establish separate private clinics, or he may be absorbed in that research laboratories in foreign countries, either it is European or Australian, or also in these USA also. So, majority of these cases is absorbed in that areas, or still after postdoctoral studies you have to return to your country. So then at that time there is a more possibility for joining in different research institutes as a universities and these colleges as a better options as an assistant professor of this scientist. So just lastly, I'll show my brief background. That is where I was previously and where I am now. And initially, I cannot think I joined as a field veterinarian after surgery, uh, as a in a SSB, and later on as a state veterinary officer. And after in 2000, I joined as an assistant professor in our veterinary colleges. And if you have the seed and the dedication of this discipline, he can do a multivarious job from the surgery background, surgery or radiology background.
Hello,
So after joining, so apart
hello.
from my teaching research, I have collaborated with
होने
some
वाला है ना।
premier research institutes in India like
सी मैं तेरे को
CSIR,
भेज दिया व्हाट्सएप
CBCR
वाला वो
Central
कर
Glass and
देना।
Serum Research Institute, Indian Institute of Technology Guwahati, then is the Indian Institute of Technology Kharagpur, NIT Raurkela, NIT Roorkee, and different medical hospitals like Arjiva Medical Hospitals, Indian Institute of Science, Education, Research in Kolkata, Jadavpur University, and this Washington State University. So, there is a surgery person. As a what I am telling that as a being a surgery person, I have collaborated with their research institute now at this moment. Their research, mostly in some labs, their research is mostly dependent on me, because until and unless a biomedical or this in vivo animal testing can be done, their research at a good quality of journal publication may not be possible. So that's why majority of these research institutes, these premier Indian central institutes, they are also coming up in collaboration with the surgery specialists for doing their biomedical research. So from this, until and unless a good research and good dedication is done, so good quality of research publication cannot be done. So that is the main thing of publications, and where it can, with this you can get some opportunities in a better areas. So from there, the research publications I have already got patent on these 5 research publications. There is a 5 patents from this government of India, and also published 2 books that are also in the market for this betterment of the students. So during this time, I just got some chances to visit abroad in different international conference. That is one conference of biotechnology. That is a research findings at this Finland, the Thailand, the Nandi Technological University at Singapore, and where also this the USA, that is this Washington State University, where being a background of veterinary surgery and radiology, I worked as an adjunct faculty in School of Material Science and Engineering. So you just see, from starting from this surgery, I have entered into this sphere of this material science and engineering and this biomedical research area. So surgery, the field of the opportunities in veterinary surgery and radiology is enormous. So thank you for your patient hearing. So these are the opportunities that has given me several national level awards, like a lifetime award from the Sophia Mexico award from the Indian Council of Agricultural Research, and some more good some awards, as already told by this institution of my introduction. Thank you.
Thank you so much, sir. Sir, participants have doubts. Question is how to collaborate with research institutes.
So this collaboration with research institutes is a difficult job. So first thing is, if you as a surgery person or there is a MNASI or a veterinary surgery, so you have to go through your course curriculum as a surgeon, as a MVSc or a PhD student. Suppose a student has been joined as a MVSc or a PhD in our institute. So, as a guide or as a supervisor, I can make some collaboration with these other areas. So, most of my students, there is the work is going on these collaborative areas with these different institutes. What I am so. But as a student, uh, majority of these institutes they will not take a direct student at their collaboration until and unless you can join as GRF, that is Junior Research Fellow, or a Senior Research Fellow in that institute. Because as per the funding agencies, that is like DST, DBT, or this ICMR, the research institute can only collaborate with these scientists or these teachers. They cannot collaborate directly with the students. So we have to join as a student in surgery, either in BSc or PhD. Apart from your guide, will collaborate with other senior research institutes also in abroad. Okay.
Sir, one more question. Can you please throw some light on the surgery field in wildlife?
So wildlife, that is a vast areas. If you just see, uh, there is no specific specialization in wildlife only, except in few years back there is a specialization in wildlife surgery or wildlife, not in surgery. There is a wildlife in this Chennai. And this wildlife surgery, if you just see, you have to be more dedicated. You have to make some collaboration or associated. You should have a good knack, and you should be visited in different zoos first, national zoos, and these forest areas. Suppose in forest also, in our state, in West Bengal, there is the Alipur Zoological Garden. So there is the posting up to veterinarians or 3 veterinarians. They have been posted as a from this government side as a deputation posting. So you have this snacks for learning this surgery of this wildlife. So you have to regularly visit and you have to make some liaison with the surgery person of that Alipur Zoological Garden or this zoos. So from where we can see the different surgeries in their closed door, and you can learn something. And not only that, in forest, in some areas like in Jallabara forest in our West Bengal, there is also posting of one veterinarians or two veterinarians. So you should one person. Similarly, in other states also, if you are a knack in wildlife surgery or wildlife knack in this wildlife work, so you should be some good liaison with the concerned person of that forestry, particularly the veterinarian. Otherwise, without these veterinarians, who can be acting as your mentor to learn something in that area. So your liaison and a good cooperation from that wildlife veterinarian is a must. Okay,
Thank you so much, sir.
okay, thank you. Any more questions?
No, sir. Participants can unmute themselves and ask the question if they have.
Any question from participants?
No, sir. No more. One question.
As for being horse specialist, which college? Because you just say there is no specific college is there. So for specialization surgery in Gadhasu, that is in Ludhiana, Punjab, you can go there. There is a good operations on these horses are done in that areas. You can also go to Pandagar side also, and also in this Himachal Pradesh, HP, that is Himachal Pradesh, that is in Palampur also. They are working on that area also. And in this particular state, there is a particular species is there. So for these horses, you can go to this Ludhiana or Himachal Pradesh in that areas. And for this camel surgery, if you want to learn, you have to go to Rajasthan. That is either this Bikaner or this Udaipur, Bharatpur or Udaipur, and also in this there is in this Jaipur also there is a government veterinary college.
Thank you so much, sir,
Any more
for a
questions
wonderful
from this
session.
side? Okay,
Any other
thank you.
queries? I think, sir, there are no more queries. So, should we conclude the session, sir?
Yeah.
Okay, thank you so much, sir, again.
Yeah.
And thank you so much, dear participants. We will send your certificates and the PPT on your registered email IDs. Thank you so much again. Have a good day.